So, hello everyone. Today we are going to explore the most important foundation of surgery, that is history taking. From this history taking, only 80% of your diagnosis is confirmed, and then surgery can be even done by a layman man if we give him 30 days to make the same incisions, to make the same sort of things he can even do. Most important is diagnosis. For that diagnosis, what you require, what you need is history taking. So let's begin. As you know that in the surgery department, you go to your surgery department, there you see almost all the cases are about swellings or about ulcers, right? So now we are going to talk about swellings, how you perfectly take the history of swelling. It is very much important in your 4th year final practicals. So please, I'll just give you a basic points, basic things that is remember. You have to remember the general points, okay? So first, let's begin with history. Let's begin with history taking. So you already know in history taking what you first is about general information. What is general information? It's a name, and you know that, right? It's been almost, now you are in 4th year, you almost have learned it in your 2nd year that what is important of name, all you know, like name, place, gender, and address, everything. These are all, I'm not going to talk about these basics. Let's go in point of swellings. So first you're going to take general information, then begins with chief complaints. See, why is this chief complaint very important? See, uh, in case of a person comes near you and he says, "Sir, since 2 days, since 3 days, like I'm feeling nausea or something, like vomiting and everything." So what you guys do, you just do some examination and you see a tumor. Okay, that is not related to your vomiting, or I'm not talking about the gastric carcinoma, not go there. Okay, you see some testicular tumors by examination. Okay, so you will say that guy that you have testicular tumor, that we have to see it is metastasized or what, you have to do that, we have to do this. Like, really, do you think he shows interest on that point? No. Why did he come to you? Just because of vomiting. Okay, first your prior thing is tumor. Yeah, I know, because that is important. But your prior thing is you have to explain him about your vomiting. You have to cure the symptom for what reason he have come. So chief complaint is very much important. Okay. Then we have third one is HOPI. What is HOPI? That is history of present illness. How you describe HOPI? Listen, patient come with chief complaints. The patient come with some cough. Example cough. Okay, what you have to write in HOPI is you have to explain about what is his chief complaint. If the person says I have cough, I had cold, I had fever, I had trauma, all these points, okay, how you explain? First he says in a chronological order how it became. First is cough. Okay, he says cough. In cough, what you have to ask the person? You have to ask him about his onset. When did it start? 2 days back, 3 days back, 3 weeks back. Then about his duration. Like since, okay, 2 days. Now since 3 days, 4 days, 5 days. Then is progression. Like slowly it is increasing, or after 5 days after having some home remedies, is it decreasing, something like that, how it is progressive or not. Then you have aggravating factor. What is aggravating factor is, for example, okay, the cough, after drinking some hot water, the cough is relieved, that is relieving factor. Aggravating is after having some fried items or something like that, and it's like it starts increasing is aggravating factor, relieving factor. These are all 5 points you have to ask: onset, duration, progression, aggravating factor, and relieving factor. These are very important. You have to ask this 4 points. Then we come about the associated complaints. In associated complaints, we mainly ask about pain. See, he says I have cough. In the cuff, you can also ask if person is having fever or pain, or you associate them with something. Okay, he's saying cough, so with cough he's having a pain in the throat, itching of type of pain, or irritable pain, or what. These are called as associated symptoms what is having. Okay, then we talk about most important is diagnosis. In diagnosis, I always say you don't say diagnosis. Okay, he says cough, TB. No, this is not the diagnosis. In diagnosis, what you have to write is cause. What is cause? Okay, we will think about let's come most important. Let's come about hernia. Hernia is almost in all the cases you see hernia. Okay, let's come up with hernia. What is cause for that person is having hernia? What is the cause for that? He says complaints of constipation. Oh, that constipation has led to hernia. He says cough. Oh, that chronic cough led to hernia. Or in case of CA breast. In case of CA breast, okay, that person is saying CA breast. What you come? Family. Oh, because of that first generation has CA breast, some of the birth. So she got CA breast. Or she's saying taking some oral contraceptive, so there is CA breast. So you have to relate whatever the patient says, try to relate. That is how diagnosis. Okay, you have to relate the cause and explain the patient, or explain the examiner. Explain the examiner. Okay. In diagnosis, write about cause, then about complications. Okay, now she has said CA breast. Will you CA breast? Okay, you have CA breast. Let me do this. No, you have to see whether it is metastasized to the organ, local metastasis, or you have seen, or you have seen any metastasis surrounding. Okay, that is also complications also have to be seen. This is all about how you do. The main important is examination. Okay, general physical examination. Patient was moderately, that all right stuff you write, and you check about temperature, respiratory rate, blood pressure, heart rate, and these all things you're going to check. Then you're going to see pickle. This is all from your physiology knowledge. Okay, this is not important. Now most important question comes, that is inspection. Inspection. See, I'm going to help you to remember this. You should not see books 20 times, turn the same page and see. Okay, it's about inspection. In inspection, remember 2 points. 1 point is about define the swelling. Second point is about characteristics. Okay, what comes define? Define, remember, N S cube E. This word you remember. You have to say number. One, solitary, multiple. Okay, then yes. Okay, we have in yes, we have side, where it is left side, right side, that side, this side, whichever side. Then we have size. It is 1 into 2, 2 into 3, 4 into 5, some side. Then we have from yes, we have side, size, shape. Okay, then we have extent. Let me explain you clearly. Okay, in number you write solitary, multiple, and everything. When it comes to side, you say it is left side, right side, everything. When it comes to size, 2 into 3 centimeters, 4 into 5. Okay, when it comes to shape, you will define the shape. How you will define the shape? The shape is like, it is looking round, oval, not circular, round, oval. Then extent. Extent is like superiorly, inferiorly, medially, laterally. That is extent. Then you explain about characteristics. Second point is about characteristics. What you will see in the characteristics? 3 remember. Surface, border, surrounding. Yes, BS. What is surface? In surface, you have only 2. One is smooth. Okay, one is irregular. These are only 2 things. Don't write surface was that, surface was this. No. Surface means you have only smooth, you have only irregular. In the irregular only you have globular, nodular. You'll write, right? That is globular surface, nodular surface, bossulated surface. Okay. In surface you have only smooth or irregular. You have to explain the examiner with smooth or irregular. Okay. Then we have borders. How will explain borders? Borders, 2 points. ill-defined and well-defined. What is this ill-defined and well-defined? And please remove from your mind that ill-defined is something malignant and well-defined is benign. No, it's the concept is not like that. Okay, what is well-defined? Well-defined is you're going to see all the borders. Okay, upper border. Now carcinoma of breast, in the breast. Okay, upper border is that areola. Lower border is from second rib to this. You're going to see each and every border properly. Okay, that is well defined. What is ill defined? Ill defined is when the swelling, like you, I'm just giving example, when the swelling has some sort of pus or inflammatory or some of the thyroid swellings which you can't see the borders, what are inside, what is inferior, you can't see, they are called as ill defined. And please remove from your mind that is malignant or ill defined. No, that is not the concept. Okay, you understood what is well defined and what is ill defined. Okay, ill defined, what you say, I'll explain you. Ill defined is inflammatory conditions, like if there is pus present, or if in case of thyroid swellings where you can see the inferior borders, you can't see those are cannot, we can't examine by the inspection. Okay, and for example, in case of liver, you're saying liver, you can't see liver, you can say its upper border is this, but when it has gone some inside of some rib or something, you can't palpate. So in inspection you can't see the borders, they are called as ill defined. Well defined is okay, inspection you're seeing this is this. Okay, next we have surrounding. What is surrounding? And here is a carcinoma of breast. What you will see in the surrounding, is there any engorged veins, is there any ulceration, is there any fungation, or in case of hernia, okay, here is the hernia, you will see the scrotum is like, is it normal or something changes, are you seeing in scrotum, is the penis being erected or is the penis being at the same place, or is there any changes you can see in the penis, there is surrounding. From that hernia surrounding place, what changes you can see, you have to write in the cases of surrounding. Then comes about your special characteristics. Okay, these you have to learn particularly. Okay, see, in case of hernia, you're not going to check by what protrusion of tongue. Can you see some changes in case of hernia? No, that you have to see in thyroid swellings. I hope you people know what I'm talking about. You know, right? In case of thyroid swellings, what you see, you'll say the patient to protrude your tongue. So due to the protrusion of tongue, you can see the movement of that swelling. Okay, in case of hernia patient, can you examine same special characteristic? No, in case of hernia, you'll see cuff impulse, you will say person to cuff, that time you will see the swelling is protruded or not, that you can't see in thyroid. So depends on where the swelling is present. Is it present like, is it a hernia, or is it a thyroid swelling, or is it a breast? So depend on where the swelling is present, these special characteristics differ. Okay, and if I start talking about this, it may take a lot of time. So special characteristics, give your time and understand. I'm just going to say you the normal features what you can say. Okay, then comes you hope you got about what is inspection, what you have to write. Okay, what you will write, first you will write this, you remember. Okay, number, size, shape, surrounding, extent. Then what is surrounding, border, surface. Okay, this is all about inspection. Now let's come to palpation. Please, most of the people forget most important thing in palpation, that is temperature and tenderness. Okay, temperature and tenderness. So these are the most important topic, that is temperature and tenderness, which you will see in palpation. Okay, and if all the inspectory findings what you have seen are correct, just see all the inspectory findings that are confirmed by palpation, like regarding of size, shape and everything. Okay, if you see any changes, you can say. Okay, almost all like inspection palpations will be similar. In case of extent, like you have missed something, or in case of size, like while seeing you it was 2 into 2 centimeter, by while palpating it like it was 2 into 3, you say like regarding the size has been increased while palpating, not while palpating size and measure, like while palpation I have seen it as 2 into 3 something, by that changes you explain the person. So here what you have to add here is everything same. Okay, you have said about E and B, S, B, S, these things you have said. What you have to add is here is consistency. You have to add a point called as consistency. What you'll write in consistency, you have hard, firm and soft. These are only three. Okay, please, consistency is only hard, firm and soft. Don't add your own words in that. Okay, what is soft? Just touch your earlobes, that is soft. Firm, touch the nose, that is firm. Hard is one bony part, you can touch your forehead, that is hard. Okay, this is how you define consistency. So this is how you explain swelling, right, in consistency and everything. After consistency, I have missed one more point, that is just a reminder. Okay, you'll write about consistency and everything. You read, right, reductibility, reducibility, fluctuations, transluminations. You have to examine that person and say the result. But like you see about those cases, because I'm just saying you normal how what words you have to remember. If I go on saying everything, it takes more than 1 hour. See, what you have to remember when it is soft, when there is soft, okay, then do fluctuation and translumination, please. In hard and firm, fluctuation and translumination, they don't exist only. That is how you give negative impact to the examiner. Only in consistency is soft, the swelling consistency was soft, then do fluctuation and translumination. This is this one point, please be clear about it. Then you have to lastly write plane of swelling. What you will write plane of swelling? Is it skin? Like, is the swelling present on the skin? So plane of swelling skin, how you will do? Pinch the skin area. If it is pinchable, then plane of swelling is not present. Okay, if you pinch, if it is non-pinchable, then it is on the skin. Then comes subcutaneous. Subcutaneous, like skin pinchability is positive in case of subcutaneous. Then comes muscle. Okay, muscle. Is the swelling present on the muscle? So in case of muscle, you have 3 things to remember. I'm sorry. Muscle, remember 3. One is above the muscle. Is the swelling present above the muscle? Is it present inside the muscle? Is it present below the muscle? What you have to do is, first what you must do is muscle contraction. You have to see the person to muscle contraction. Please, you should know in case of pectoris how the muscle get contracted. That is your general anatomy. If you want class on that, then please comment. I'll explain you about those things. In muscle contraction, if it is above, okay, see, there is carcinoma of breast. I'll give you best example is carcinoma of breast. Okay, I'll take carcinoma of breast. So if I want to see is the lump or is the swelling is infiltrated in a muscle, that is pectoris muscle, I'll say pectoris muscle to get contract. Okay, then I'll see if that swelling becomes more prominent, it means that the swelling is above the muscle. If the swelling remains same, the size have not changed at all, then it is present below the muscle. If the size is going reducing, then it is present inside the muscle. This is how to remember, easily you have to remember. Then you have intraperitoneal and retroperitoneal. In case of intraperitoneal and in case of retroperitoneal, in case of retroperitoneal, if it is retroperitoneal, there is no movement in respiration. If it is intraperitoneal, there is movement in respiration. Okay, these are basic. Okay, these are basic. If you want, like, these are basic matlab I've not gone through each and every point clearly. If you want me to explain each and every point clearly, just be in the comment section. I'll know about which topic you want to get, and I'll explain you. So please, thank you.